With news of a second possible case of the coronavirus reaching the U.S., UNMH is keeping a close eye on this deadly new virus and warning New Mexicans about what to watch out for. News 13's Chris McKee spoke to a researcher about it today. Chris?
Yeah, and Dean, to be clear here, there have been no reported cases of this new coronavirus identified or even suspected in New Mexico, but researchers and doctors are trying to make sure they're ready.
This is the sort of virus that tends to be on my radar.
The UNM Health Sciences researcher, Dr. Stephen Bradfeud, has worked on vaccines for both the Zika and Ebola viruses.
I like to say that it's good to be cautious, but it's not good to panic.
And that is what he is now saying about the new coronavirus that's killed at least 18 people and sickened more than 600, mainly across Asia. Bradfeud and other researchers at UNMH are keeping a close eye on the new virus, worried about its continued spread.
The areas of concern is that it is most closely related to SARS, which caused pretty big outbreak several years ago.
U.S. doctors have confirmed at least one case of the coronavirus in Washington state. College Station, Texas health officials announced today they're investigating the U.S.'s second suspected case in a Texas A&M student.
The patient had traveled to the area of concern, developed mild symptoms after returning.
Bradfeud says it's too early to tell just how big of a deal the new coronavirus is, but the similar SARS virus killed nearly 800 people in 2003.
But right now it doesn't seem to be as dangerous as SARS, although that could change.
If a patient were to show signs of the illness in New Mexico, they'd likely go to UNMH and be isolated in one of the hospital's quarantine areas.
This is something that the hospital is equipped to deal with.
In the meantime, UNMH is following the guidelines the CDC is suggesting for anyone with a respiratory illness.
Travel history and then have you been around individuals that might be exposed to this virus are important questions to consider.
Bradfeud says one of the biggest and hopefully most helpful differences with this coronavirus as compared to SARS is that Chinese researchers identified and released the virus's genetic code in a matter of days, whereas typically that has taken weeks in the past. Dean?
All right, Chris, thank you. Now, in the latest suspected coronavirus case in College Station, health officials think there is a low risk of infection to other students at Texas A&M who may have come into contact with the affected student.